what would be the elements of a bill? First, it would expand health insurance coverage so that every American has access to affordable, high-quality health insurance. Most Republicans and Democrats can agree on the basic reforms that will help lower the costs of health insurance and allow patients with pre-existing conditions to be able to buy insurance. Now, there's much data and testimony that tells us that greater affordability and increased access are not mutually exclusive. More than that, the more we learn about the costs driving up our system, the more we recognize that if done correctly, greater access can drive down costs. Now, I like to use Medicare Part D as an example on that. When we were doing that, we only had 2 companies in Wyoming that were providing pharmaceutical benefits to seniors, and I was pretty worried that after there were some federal regulations that came into play, that we would have none. And I thought politically I'd be in a lot of trouble if my people in Wyoming didn't have any coverage. So we put in a backup plan. If a state didn't have 2 bidders, then the federal government could provide the pharmaceutical coverage. We wound up with 49 companies that wanted the business of the 500,000 people. Well, it's less than that because it's just seniors, but we only have 500,000 people in Wyoming. And that's why we have a little problem in the competitive market sometime and why there aren't more businesses that are interested. But we wound up with 49 companies that wanted the business of those seniors. And the price came down 37% before the first person signed up. So competition does work. And the second point is that the bill has to use private plans to deliver the benefit. I believe that most Republicans and Democrats can agree that a patient-focused health care system will provide the highest quality and the lowest cost, and here's an important one, with the shortest wait times. Be sure and take a look at wait times when you're looking at some of the other countries that provide health. It's another way of rationing health care. If you're over 65 and you have to wait a year for some of your tests and more time than that to get the treatment for it, you're going to be dead, which probably helps out their form of Social Security as well, but not a good idea and not what we're used to. So the wait time has to be a factor in it. When patients are choosing among competing private plans, and when patients can vote with their feet, insurance companies will be forced to deliver better quality care. Now, we've heard much debate about a public plan option, and we've heard Democrats recently begin to back away from a government-run plan. Maybe you haven't noticed that, but I think they're backing away or holding it out there as something to trade in the future. I believe that many of my colleagues are beginning to see that increasing the size and scope of government's role in health care and a further squeezing of private marketplace will drive up costs and drive down quality and increase wait times every single time. As the public, the editorial boards, and reasonable people on both sides of the aisle continue to delve deeper into the practicality of a public option, I believe it will continue to recede further into the background and become less of a trading item.